Alright, so for the next joint we should be looking at its basic anatomy is what is known as a distal interphalangeal joint. Right? Distal interphalangeal joint. So interphalangeal is like inter between, So interphalangeal is more of like, joints that we have between the phalanges. So the ones that are closer to you, you see that they are proximal. The ones that are away from you, you see that they are distal. So just want to look at the distal ones, just talk about them briefly, because later on we were talking about injuries in the hand, infections in the hand. If I'm mentioning them, let it not be totally strange. So the distal interphalangeal joint is like the last joint, is the one that is mostly away from you, the tips, so it's closest to the fingertip, connecting the middle phalanx to the distal phalanx. So this joint plays a key role in fine motor taxing. Like me to be able to type this, I should be able to grab my phone, I should be able to button my shirt. Alright, so anatomy and function is the joint type is synovial, movement is flexion and extension only, ligaments, medial and collateral ligament, innervation is a proper palmar digital nerves, blood supply is a proper palmar digital arteries. Alright, so these are all the common disease conditions that could occur at the distal interphalangeal joint, right? So osteoarthritis, psoriatic arthritis, gout, trigger finger, trauma, right? So symptoms of this is if there's any injuries at the distal interphalangeal joint, usually result in stiffness, burning, swelling of visible nodules, reduced range of motion, cracking or crepitus, nail changes. Alright, so treatment if it's inflammation, non-steroidal anti-inflammatory drugs, splints, physical therapy just to return the flexibility, surgery, cases of bone spurs and all of that. So I think that's just it for the concept of the distal interphalangeal joints.